Hi, my name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome to the vlog post about a very difficult topic, end-stage multiple myeloma. In essence, how do caregivers, how does the patient and caregiver tell what indicates end-stage myeloma? And in fact, there's no specific one thing that tells a person they have end-stage myeloma. Essentially, what will happen is a series of, basically they'll stop responding to therapies. Myeloma will tend to grow, and creating problems with bone pain, kidney. Essentially, the patient and oncologist no longer is able to control the patient's myeloma. It's oftentimes after years of treatments, so it's not totally unexpected. The challenge is that, and I've been there myself, we always want to try one more therapy in an effort to stop the myeloma or by one more remission. And I can completely understand why patients want to do that. The challenge is that chemotherapies, as you know, are expensive and it can be very painful, can lead to all manner of short and long-term side effects. So the challenge is figuring out when the patient reaches, the technical term is multi-drug resistance, MDR. They're no longer responding to therapies. Talk to your oncologist. Tell your oncologist your goals. I encourage caregivers to try to listen carefully to the myeloma patient, probably a survivor at this point, in an effort to figure out what the patient wants to do. As you can imagine, I have sympathy for myeloma patients. If you have any questions or comments, feel free to scroll down, click through to the blog post, and ask me a question, and I will reply to you ASAP. In the meantime, thank you for your time and attention, and hang in there.